Carolyn Booker, thank you for being with us today. Rather than me doing some sort of introduction of you, I'm going to ask you, will you please start us off by just telling us the Carolyn Booker story?
Well, first of all, let me say how humbled I am to be here. And really and truly, this is just a joy. I have been working here in Forsyth County for, this year will be 22 years. I've been a part of Northside Hospital, as well as the hospital that was there before it, Baptist Medical Center, which was part of the Georgia Baptist family. However, starting back at the beginning, I was born in Mobile, Alabama, but I have been in Atlanta since 1983. I've been a nurse for this year, 42 years, and been in leadership for about 36 of those 42. So, how did I wind up here? Well, if I could just look across the table.
Don't blame it all on me.
I've known Lynn Jackson for, oh my gosh, since 1991. Do the math. And we have worked together in some form or fashion throughout all of those years. As a new nurse in Atlanta, because I became a nurse in Mobile, Alabama. And definitely there is a tremendous difference in the manner in which healthcare and hospitals were run there and how they were run here. It was really a pleasant shock and surprise when I came to Atlanta and found that I was able to work Monday through Friday and was off every single weekend working in a hospital. But needless to say, there were some significant changes in healthcare that really created probably one of the biggest challenges, I think, and that was in the 80s, when hospitals went from fee for service, where whatever the hospital charged, that's what insurance companies and the government paid, to what was known as diagnostic related groups. At that point, hospitals changed and the landscape for leadership changed. I became a leader in 1988, and it was trial by fire. There was no such thing then as providing you with education. There was a thought that if you were a good nurse, then you should be able to lead. I had many, many, many sleepless nights. I cried multiple times when physicians would approach me with concerns. But I learned. And here in Georgia, this is where I actually started my leadership journey from the standpoint of academics, and went on to formalize my education and achieved degrees, master's degree, and then also a doctorate degree. And those degrees are in nursing administration and or leadership. So leadership is really a huge part of who I am and also what I do. But it's really and truly a blessing to be able to be in a position to lead. Truly a blessing. So with that, I'm going to just share with you a little bit of my philosophy as it relates to leadership. It is really the ability to influence others and to actually influence them in a way that they wind up being more than they thought they could be. That they actually have the opportunity to work toward a goal. As a leader, you help them to find their purpose, because many times people don't know. You might ask an individual, well, what is your purpose for working? And the person says, well, I want to make money. Well, that's a goal. but what is your purpose? What is that thing that really sets you on fire? For me, it is actually working toward creating an environment in our hospital where healing occurs for patients, but also for staff. When you walk into the building, it's like, I call it the balm of Gilead, where there is so much kindness and so much positivity until negativity can't stand it, can't stand to be around. And so that is something that actually I've been inspired to do as a result of the work that I've done with Lynn.
Wow. There's a lot in that to unpack. That's awesome. Very good. So let's start kind of with, you talked a lot about changes in the healthcare industry. And
Yeah.
I'm sure there've been lots of iterations of that. So and maybe not as earth shattering, but every industry goes through some sort of change and evolution. So when you look at both in your own path and the path of the folks that you work with, when you look at what does lifelong learning mean to a leader? What does that look like? What is the value in that? And where does that motivation come from as a leader to invest in that? Because of course that's always a challenge, is helping develop your team.
Yes.
And knowing that. So what does that look like for you?
Well, for me, lifelong learning, formally, it's when you're taking those classes. One of the things that I found that learning does is that it opens your mind to possibility. When your mind is closed, many times you'll be in a situation where you're not able to capitalize on opportunity. You won't see it. When your mind is open, you are able to capitalize. You're able to see things that you would not have even conceived of originally. I can tell you, I was a diploma nurse, and diploma nursing, when I graduated from nursing school in 1981, there were numerous hospital-based schools of nursing. Now there probably is only one left in the United States, one. That type of nursing education, while extremely valuable, was found to be antiquated. And the move was to create nurses who were more educated on theory. The nurse that was educated in the hospital setting was more of the practical type of person who could deliver the care. But the nurses that we have currently are given more of a theoretical framework, and it has its value as well. But the point I'm making, though, is that as a young nurse coming out of that background, in those days, we were considered to be the backbone of a hospital because we were trained in that hospital. And I came to Atlanta, and my thought was, I know everything I need to know. And I remember talking with a young lady who was actually getting ready to go back to school to get her bachelor's degree. And my conversation with her was, well, why are you going back? I mean, we know what we need to know. And she went on to try to explain. I still didn't get it. I became a manager, and there was a meeting that we had where we were called into, all the managers were called into a room. And we were basically told that in order to continue the journey of leadership, if we were not degreed, then we would need to pursue obtaining a degree. And my grandmother told me a lot of things. Many of those things I say even today. And one of them was, a word to the wise is sufficient. And that's all that person had to say, the word. I immediately enrolled into a bachelor's program. When I did, I found as I went through and matriculated through the coursework, my mind began to open. Things that I thought were, no, it couldn't be that. It turns out the possibilities of what could be done to address certain small issues that I thought I was stumped. But once I got that education, the path illuminated. And it continued for me that way, even through the master's program and through the doctorate. Now, I actually enroll in classes that are done, let's say online classes. Again, with the thought that this will help me to help someone. And I found that to be very, very true. So just online learning is huge. And many of you are probably engaged in that. But then also too, one of the things that we have within our system, we have all types of courses that one can take. But I do a lot of that.
Very good. Excellent. So related to that, and I'm just curious, with all that experience behind you, and you went and got a PhD, that is phenomenal. So what did you feel the motivation behind the PhD was?
Well, and actually my degree, advanced degree, terminal degree, actually, it's not a PhD, it's a DNP.
Okay.
And it's doctorate in nursing practice.
Very good.
So in some ways, it does validate
Yeah.
that diploma nurse.
Yeah.
Because it's about the practice of nursing and it's about the delivery of care.
Yeah.
So what really prompted that was the fact that within the DNP, when you are doing your project work, you actually look at a problem. And the problem that I looked at was pain management. How patients' pain is managed when they are postoperative in the hospital setting. You're able to create a project working with individuals in the healthcare setting and on the nursing units, and you're able to bring forth through research and also application an outcome. And the outcome that we were looking for was, number one, improvement in the nurse's ability to assess the patient's pain, improvement in the nurse's ability to empathize with the patient and put themselves in the place of that patient, improvement in an increase in their compassion, their wanting to do something about that pain. And then, of course, the documentation, accuracy, and then the ultimate, the patient's response to that. And we were able to deliver, actually, for the organization, an improvement in the patient's perception of how they were treated in terms of that pain. So it was really a very successful endeavor.
Cool. Very good. So I also, for those of you who are new, I ask this question every time too, so because it seems so. Anybody in here having a problem trying to find employees or keeping employees? Anybody had that experience? I know it seems to be pretty rare. So and of course, you know, it's on the national news once a week or more about particularly a nursing shortage, but just healthcare in general. So in your work in facing that, both, you know, and I imagine it is on both sides, both keeping and finding. What do you find is for you an effective path at finding talent, knowing what talent should come into the organization, and then how to keep them? I mean, ultimately, it's become a universal question, but but particularly as well known as that is across the country. I mean, what's the experience for you, and how do you address that, and how do you approach that?
Well, you know, in COVID, oh my gosh. You know, I was a younger nurse during the HIV crisis. And that was something that was definitely a huge challenge. But I've never seen anything like COVID. Nothing. And you talk about being in a situation that was dark. It was just dark. That's what it, to me, when I think about it, it just reflects as a time of darkness. Our hospital, as well as hospitals across the country, experienced a huge exodus of nurses. There were nurses who retired, nurses who, due to family situations, moved away from the bedside. And then there were definitely the nurses who traveled and went to make that money that was out there everywhere. And so the challenge then became, what do we do? And in our facility, we have our managers are on a text string on their phones, and I'm on that text string. And what I saw them struggling, trying to cover and trying to figure out how we're going to have enough staff. And big challenge. So they would basically send out a picture of the staffing for that night. And then after that, there would be call-outs. And those call-outs would come across the text string. This person, this unit, this unit. And I thought to myself, as the chief nursing officer, what can I do to help? I began to, again, this is drawing back on education. Think about how I was originally trained. And when I was trained in Mobile, there were registered nurses, there were licensed practical nurses, and there were nursing assistants. In the evolution of nursing, the licensed practical nurses had actually been sort of moved out of the hospital setting. And they mostly were working in correctional nursing, perhaps doctor's offices, long-term care facilities. And it came to my mind, my goodness, what if we could bring licensed practical nurses back to the bedside in the hospital setting? So I reached out and asked if I could do a pilot. And I was told yes. And that pilot started with 8 licensed practical nurses. I researched a way to train those nurses that was different from the way that we typically train. And that pilot was successful. The pilot actually was adopted by our main facility, Northside Atlanta. They got on board. Now, the licensed practical nurses are a part of a care delivery model that we have called team nursing. And that model is in use at all 5 of our hospitals. All 5 of our hospitals hire licensed practical nurses now. And the situation with us, we started with 8 licensed practical nurses. We now have 69 and continuing to hire those licensed practical nurses. Many of them have gone to school and become registered nurses. So it has proven to be a very, very, very good partnership. But that too, in my opinion, came about as an idea and a concept. And to be able to roll something out like that requires additional education.
Very good. So you talked earlier about kindness.
Yes.
I don't think anybody in here probably thinks that kindness is in overabundance these days. So good for you. There's a lot of discussion. Actually, I think there's a lot of discussion broadly about just, not just in organizations, but how in the community, in the world, to make it a kinder place in the face of, clearly some not kind things going on out there.
Yes.
So for you, where did that come from? What was the importance behind that? And how do you build a culture of kindness?
So it started actually probably with one of the mass shootings what was the name of that school out in the
Sandy
west?
Hook?
Not Sandy
No.
Hook, but it was out Midwest, Columbine.
Yeah.
That was, yes. So Columbine, and then Sandy Hook. And then there was a shooting in the church. And then there was the shooting where the person went into the hospital. Not the one where they, the more recent one, but this is the one where they shot a supervisor and they killed their supervisor. Around that time, I mean, I had just really stopped watching television, but really, you still would see all of this happening. And I was thinking to myself, you know, as a young child, I could remember there being places of sanctuary. You know, a church was a place of sanctuary, a school, sanctuary, a hospital, sanctuary. And all of that had been violated. People had come in and brought violence into all of those places. And I thought to myself, you know, what could I do? Because I also felt then that some of that was seeping into the workplace where I was working, where people were not being as nice to one another as they could be. And remembering that, what happens to me and how I respond to that affects everybody that I work with, everyone that comes in contact with me. So one of the things that I thought about was kindness. And I began to look online to see what's out there. What is the current research? What's there? And I really couldn't find a lot at that time. This was in 2018. And I did find, though, an organization called kindness.org. And they were actually offering to help organizations to bring kindness into their workplaces. And they were talking about building a kindness wall. This was just a concept that they were creating. And so I reached out via email, and the young lady there and I began to sort of communicate back and forth. She sent me some materials, and I just happened to be at TJ Maxx that weekend and found a huge carton of kindness bars. And I thought to myself, there's a reason for this. So I bought several cases of those bars, brought them into work, and went to our emergency department and just started handing them out to staff. Oh my goodness. Just the act of giving. It really can help you understand, I think, the spirit of philanthropy, helping people by giving. Individuals who didn't really want a kind bar were kind in their refusal of the kind bar. That, I mean, you couldn't ask for more. You couldn't ask for more than that. And then also too, one of the things that always happens in the hospital setting, we get a lot of gift baskets. People come and they bring things to us. So there was one day I asked Lynn if I could take this basket of goodies to L&D. And she said yes. So I walked over there. Good morning, ladies. A bunch of them were sitting at the table. And I said, this is for you. Set it there. Oh my gosh. And I'm telling you, the positive vibes that came from those people back to me, I said, there's something to this. And then I began to do research. And in the research, there is evidence that tells us that when you do something kind for someone, you actually will secrete a hormone, oxytocin. Feels good. The person gets that feeling, and if anybody else witnesses it, they get it too. I have been at Starbucks and someone that I did not know bought my coffee. And I bought the coffee for the person behind me, et cetera, et cetera, et cetera. Typically that occurs 3 degrees of separation as a general rule. But at this juncture, now there are all sorts of organizations that are dedicated to kindness, the proliferation of that. There are organizations that will come into a workplace and help them figure out how to create more kindness within that facility. There is the Greater Good Science Center that is out in California. They are doing a tremendous amount of research. There are hospitals that have, as part of their philosophy, kindness. Huge, huge work. So over these past years, there's been a lot of work that's been done. So what we did at Northside for Sight, again, reaching out to Lynn to ask for permission to be able to create this initiative for kindness. And so what we did was we had the staff to log kind acts, because one of the things that research shows is that when you're mindful about your kindness, because a lot of people think, well, if you think about it, that's not good. No. You want to be intentionally kind, because when you're intentionally kind, it aligns to purpose. And purpose fuels connection. And connection helps all of this in terms of positivity to spread. So we actually created a kindness challenge within the hospital setting and all of our office practices and whatnot. We were able to, in 6 months, gather 11,000 acts of kindness that the staff created, 11,000. And it was, you talk about being in an environment that was just positively charged. Oh my gosh, it was phenomenal. But again, because of that, Northside Hospital saw what we did. And now the system has, as part of its vision, mission, kindness, it's embedded in our service behaviors. There are all sorts of formalized activities that we engage that include kindness. So it became something that started at Northside for Sight, and now it's a part of the whole system. And we're definitely proud of that.
That sounds like an incredible description of leadership. That's phenomenal. So who do you look toward for mentorship, for inspiration? Who are those folks for you?
Well, let me just say, Lynn and I are kind of like sister girls, right? And I also, though, work with and have worked with some phenomenal nurse leaders. And many of them have retired now, which gives them more time to give me advice. Because I'm still working, but many of them have retired. But what I'll say though is, one of the things that I'll never forget that Lynn did for me, and this was back in 1995, when I got my first degree as a nurse. She gave, well, before I say this, at the time, she was the vice president for nursing. So needless to say, at that point, I was very superficial. And my thought was, oh my gosh, the vice president for nursing, I know her. She knows me. I've graduated. So that means gift time, gift time. So I'm looking for, a new car. Something big, right? Something big. And Lynn was the vice president. I was the manager. Now, she calls me to her office and I come in and she's making this huge big deal about my graduation. And then she hands me
A kind heart.
well, it was sort of like that, yeah. It was a book. Oh, thank you. Just what I needed. I opened the packaging. I didn't get it. The title of the book was, "Oh, the Places You Will Go."
Okay.
But listen, I didn't get it. I did not get it. For a while, I thought, what is Lynn trying to tell me? I read it, and I still have the book. I read it, but I couldn't get it until several years later. And we were working together in a situation where we were in Warm Springs. And at that time, I was a director of nursing, and Lynn was the administrator of that facility. And I was getting the opportunity then to become an administrator of a long-term care facility. And then I got it. Oh, the places you will go. And now I'm a chief nursing officer. Oh, the places you will go. And it all started. I knew her when she had long black hair. I thought about that this morning. She had long black hair. And she was actually a leader in surgical services. And I was just a manager. But in reality, not just a manager. Because everything that I learned then has brought me to where I am now. And what I'll say too is this, from a leadership perspective, one of the big things that we all have to take into consideration is the fact that there has to be an element of staff well-being. So what is that? That is the feeling that you get when you come to work and you feel safe. Safe from the standpoint of being able to be yourself. Safe from the standpoint of knowing that there is someone there who is going to advocate for you if you have a need. So for example, this morning, I received a call from one of the managers, and there was a supply that she needed for a patient. And she was having difficulty in having that supply available. I told her, don't worry, I've got you. So then I reach out to the materials manager and I let him know, I understand that we don't have this, but we need to get it. I need an ETA on it as soon as you can get it for me. He reached back, it's on the way. I reached out to her, it's on the way via text. So then I get a thumbs up. Well, that's one less thing that she has to worry about. And from a leadership perspective, that's one of the things that we do. We want to set our employees up so that they don't have to worry. And that improves their well-being. And when employees are in an environment where they feel that they're being cared for, they then can care more for others because it gives them the space to do that. If that makes sense.
Absolutely. Phenomenal. So, I'm sure things don't go right every day.
No.
How do you approach bringing folks along when things are going wrong? And that could be anything from, how do you help people resolve conflict to, the inevitable thing that goes wrong and helping folks get through that moment.
So conflict, let's talk about that. There is something to be said about conflict. And in some ways, it can be good. It depends on how it's addressed and how it's handled. What you really don't want, you don't want sheep. You want diversity in thought, in how you think about things. Another one of my sayings, if everybody thinks alike, then somebody's not thinking, right? So there is that piece, and you want to come to consensus. You want to be in a situation where we all agree on the best possible outcome and possibly have a contingency plan, because that contingency plan could be the individual who brought the conflict, the person who basically is saying, yeah, but what if? Because you always need to have a backup plan. Now, in those circumstances where you got individuals that are not accountable, so let's talk about that word, accountable. Typically a word that many people find unpleasant, and in reality, it shouldn't be, because accountability is just providing feedback on what you did and why. Or if you didn't, what happened? And from a leadership perspective, we need to understand and know what that is. But I'll say this, when you are kind, kindness allows you to be able to work with people to an extent that even if you have to part ways, they are saying to you, I know that you did everything that you could to help me. And I've had that experience before with an individual or more than one person that I've had to part ways with. But those individuals understood that where they were going and where the organization was going were not the same spaces. And what I can say is that if you, with employees that you work with, make it a point to have those touch bases, those conversations where you're talking about work and where you're talking about goals and where you're talking about purpose, not just when things go wrong, but also when things go right. It's one of those situations where when something does create a situation where you've got to part ways, it's done with humility and grace. Doesn't have to be a fight.
Excellent, excellent. So you mentioned COVID a moment ago, and I cannot imagine, even begin to imagine what that was like in the walls of the hospital. How did, what motivates you in those really challenging times? I mean, I'm assuming that it's just a draining time. What puts that back in you as a leader to push through that and through something so incredibly challenging?
I will say that it was one of those situations where, when you go into healthcare, in my opinion, there is a calling that is placed on your life. And it allows you to have a level of resilience. And what is resilience? It's the ability to come back. It's the ability to come back. And during the COVID pandemic, there was a lot that was out there about hospitals that were challenged in terms of their ability to protect the staff. Northside was not one of those hospitals. Northside made sure that we had everything that we needed, every single thing. From the time that we got our very first patient, when we got our very first patient, the doctors were stumped because the treatments weren't there then. The only thing that they could do was treat whatever the patient was presenting with. And we were meeting every morning by phone, doctors, nurses, all the leaders, hospital leaders. We were on this huge conference call every single morning, Saturdays and Sundays, talking about what we were going to do, how we were going to do it, checking to ensure that there were supplies, that there were treatments, everything that we needed to care for patients. Again, that is something that really fuels you when you know that your leaders care, when you know your leaders care. So what I'll say is when you have those challenging moments, purpose is really what drives you.
Very good. Well, we have come down to the last 10 minutes. I want to make sure if anybody has a question or something they want to say, that we've given everybody a chance to,
I answer.
please.
So what she didn't tell y'all, I could tell you a lot she didn't. But things that she didn't tell you is, one, Carolyn, where do you live?
I live in East Point, Georgia.
Oh, gosh.
That's
And
right.
how long you been living there?
I've been living there since I came to Atlanta in 1981.
So Carolyn, you know that exit at the airport where there's an exit right there? That's where Carolyn lives. So, she makes that drive. Not only does she commit herself to our place, but she makes that drive every single day. And, so I give her a lot of credit for that.
Speaking of that, let me tell you this. Let me tell you. So Lynn.
I shouldn't have opened this.
So this was 1996. Lynn, at the time, again, vice president for nursing. So she offered me an opportunity to become a nursing director. Another one of those situations where it was a gift. And she said, Carolyn, have you thought about becoming a nursing director? Lynn, I'd love to. Well, I have a position and it's located in Warm Springs. I said, certainly. Well, you might want to think about it. No, Lynn, no, I'm happy to help. I'm happy to help. Okay, then, so I'm going to pick you up tomorrow and I'm going to take you to the facility. Okay. I hang up the phone. Where's Warm Springs?
I knew she didn't know.
Warm Springs, Georgia was near Columbus. I drove to Warm Springs for Lynn Jackson every day. Every day.
Yeah, yep. And the other thing she didn't tell you, she is the funniest human being on the planet Earth. Every day, you know, what her superpower is making people laugh. And she makes us laugh every day till we cry, which is our therapy. every
Yes.
day. And she and I, you know, laugh about, sometimes we just recycle the same story. So good. You know, you ever had a story and really you should tell it more than once because you've not really laughed hard enough to really enjoy it fully.
And to prove that point, and I don't know if Carolyn knows this, a story that Carolyn told you, that you told me, I have literally marched I came this close to passing out. I laughed so hard. And one day we'll tell that story. I laughed so hard. So actually, that's actually though, a really good, so, you know, you're surrounded by very serious stuff all day, you know, people are at the worst, you know. I mean, I do think about that a lot, about like most of people at their worst and hardly ever at their best. So, what role does that play for you? And really as a leader, like what role does humor play for you?
Humor actually, used appropriately, can break the ice, and it definitely fosters connection. There was a situation that I had over the summer. We had lost one of our managers, and so I went up to the unit and began to sub for that manager. So part of what we do from a leadership perspective, we make rounds on patients. And so there was a particular patient I made rounds on. That patient was 74 years old. She was going to be 75 that July. So this was in June. And what I noticed about her, she was there with kidney disease. But what I noticed about her was how pretty her skin was. Even though the first day that I saw her, she wasn't feeling very well. So I really focused on how she was feeling, what we could do to address her situation. But the condition of her skin was something that really stuck with me. So the next day or two, when I rounded on her, she was perky. And so I asked the question, what do you use on your skin? And she said, I use Sea Breeze. And I said, what's Sea Breeze? Because I didn't know what it was, but it actually is an astringent that was in use in the 60s and 70s. And she said she'd been using it that whole time, even up to now. And I said, girl, your skin is gorgeous. So that became our connection, her skin. What wound up happening actually was that I ordered Sea Breeze and got it from Amazon. I got 2 bottles, one for me and one for her. When I came back to work that next Monday, she had gone home, was discharged. So I boxed up a bottle of Sea Breeze and sent it to her and told her, girl, thank you. And as a matter of fact, this morning, what did I put on my face? Sea Breeze. Yes, I'm using it even today. Even today. But there is something to be said about the ability to make patients laugh. Even in the face of, I was in a room this morning and we were talking about grits and cornbread and okra, all these things she didn't like. Okra, and what was the other thing? Something else that we eat from a Southern perspective. Yes, yes. She's from New York. And I mean, she sounded almost like a mob wife, really. But she was not feeling it. But we were basically saying, sis, this is what makes us Southern girls. It was me and the patient's nurse. And we were just laughing. And my thought was, wow, this is what makes the environment what it needs to be.
Victor Borge once said, the closest distance between two people is laughter. And I
Yes.
think about that a lot. So, anybody have any questions? We're coming down on that,
Great
please.
presentation.
Is there any podcasts that you would recommend? Because I'm big into motivational, because it's, you know, to hear it on repeat sometimes, to surround myself with positivity. Like when I go for walks, I know Brene Brown's a big one, but
Yes.
is there anybody? I've just recently started listening to Mel Robbins.
Mel Robbins is awesome.
Yeah.
But I don't know if you have any that I might not know of.
Well, I'm sure you know Simon Sinek.
Yeah.
Simon Sinek.
Climate Cities?
Simon
Sinek.
Sinek.
Oh,
Sinek.
The Power of Why.
The Power of Why. I mean, he's phenomenal. It's phenomenal. And he's done a number of TED Talks. And he actually has a consulting firm.
If
as
you go,
well.
if you go back to what, so just Google Simon, and it's Sinek. If you look at, go on TED Talks,
Yes,
and if you look at his very first TED Talk, it will change your life.
Yeah.
okay.
yes.
It'll change your life.
Thank you.
Yes.
Thank you. I will. Thank you.
And another very good TED Talk, and it's very short. It's how to start a movement. That is a phenomenal TED Talk as it relates to basically being brave enough to step up to do something differently, and how you can make a huge difference.
Question.
Oh, sorry.
Carolyn, in all of your years of leadership, if you could hop in the DeLorean that's parked in Lynn's garage, rewind to a year of 40 years of life, what would you tell your 40-year-old self?
It's going to be all right. It's going to be all right. Because I think there are those times when you think that you panic. And you think, you know, am I going to be able to achieve all my goals? Am I going to be able to do? But I'll say this, there is a Bible verse. And it's Jeremiah 29:11. For I know the plans that I have for you, saith the Lord. I could tell you a story about that. We were in a joint commission survey, and the joint commission, they are the holy grail of inspectors. They are inspecting our hospital for CMS to ensure that we're doing everything that we need to do. So this was not in the last one, this was in the one that we had maybe 3 years prior. And I found these bookmarks, leather bookmarks, that I had ordered for the managers. And they came right at the time that we had this surprise survey. And I walked around to every manager and I handed them one. And I said, keep this in your pocket. And that survey, not to say that, but it was one of the best that we've ever had. And I found that there were several times that I mentioned that Bible verse to people. And it brought them to tears. Because there is this whole concept of the good that we can bring to others, the good that we can remind them of, it can actually help to lift them. And so what I'll say to my 40-year-old self, it's going to be all right.
Very good. All right, y'all, we have come to the end. Thank you all for being with us. Carolyn, I have been thrilled to death from the moment Laura told me that she had booked you to come. And I know that you're one of my favorite human beings on this earth. And I knew this was going to be great, and it was so much better than I knew it was going to be.
Thank you.
Awesome. You're
Thank you.
so, and really, it is very easy for us as a community to forget, just a few years ago, what a crisis we were in. You mentioned, we were surrounded by communities who did not fare well and had hospitals that did not fare well. And as far as I know, the only thing that makes us different is y'all's leadership. And while other hospitals were still struggling, Lord, y'all were out putting vaccine clinics out in parking lots. And our community fared way better by every measure. And really, the thing to point to is leadership. So on behalf of a grateful community, I haven't forgotten. And I don't think anybody in this room has. So thank you both very much.
Thank you.
And thank you all.
Thank you.